Aldosterone antagonists, or mineralocorticoid receptor antagonists, are one of two types of potassium-sparing diuretics available. They block the action of aldosterone in the nephron, or the functional unit of the kidney. Specifically, they act in the late distal convoluted tubule and collecting duct, where aldosterone increases the reabsorption of sodium from the filtrate to the blood in exchange for the secretion of potassium from the blood to the filtrate. This movement of sodium also creates an osmotic gradient in which water can follow, and therefore is also reabsorbed. Aldosterone antagonists block aldosterone, and therefore less sodium and water are reabsorbed, creating a mild diuretic effect while at the same time decreasing potassium secretion and thus loss. The two most common aldosterone antagonists are spironolactone and eplerenone. Aldosterone antagonists can be used to treat edema caused by secondary hyperaldosteronism, resulting from conditions such as hepatic cirrhosis and nephrotic syndrome. However, it's important to note that there is minimal diuresis when aldosterone levels are low. Aldosterone antagonists are also often used with other diuretics, such as lupirthiazide, to treat hypertension and decrease potassium loss. This medication can also lower heart failure mortality by preventing cardiac remodeling, particularly in those with a reduced ejection fraction. Furthermore, aldosterone antagonists are used for primary hyperaldosteronism, hormonal acne, to reduce male characteristics in male to female sex change, and decrease androgen levels, or male sex hormone levels, with polycystic ovarian syndrome. The most common adverse effect of aldosterone antagonists is hyperkalemia, or elevated serum potassium, typically greater than 5 milliequivalents per liter, which can result in life-threatening arrhythmias. Additionally, spironolactone, in particular, has a similar structure to steroid hormones, such as progesterone, estradiol, and testosterone, and as such poses a risk of gynecomastia, or enlargement of breasts, erectile dysfunction, and decreased sperm production in men, and menstrual irregularities in females. Aldosterone antagonists can also cause metabolic acidosis, as aldosterone plays a role in hydrogen secretion, and when blocked, hydrogen can accumulate in the blood. Aldosterone antagonists are contraindicated with anuria, or absence of urine production, severe renal impairment, hyperkalemia, and Addison's disease. Caution should be used when taking aldosterone antagonists, while also frequently consuming salt substitutes or potassium-rich foods, as it increases the risk of hyperkalemia. Generally, individuals on this therapy require routine blood work to measure serum potassium. And finally, some drug-to-drug interactions worth mentioning. The risk of hyperkalemia increases when aldosterone antagonists are used with angiotensin-converting enzyme inhibitors, angiotensin II receptor blockers, NSAIDs, or potassium supplements. I hope you found this video useful, and if you did, please let me know by giving this video a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!